November 1, 1902, Boston Evening Transcript, Boston, Massachusetts. Measures to check plague. Marine Hospital Service to act in San Francisco. Washington, November 1. The Marine Hospital Service will take immediate measures to relieve the plague situation in San Francisco. The conditions in that city have been brought again to the attention of the federal government by the resolutions adopted on Wednesday at the meeting of the state and provincial boards of health in New Haven, Connecticut, which were printed at the time in the transcript. The disease broke out in San Francisco 2 years ago, but the state and municipal authorities sought to conceal the fact for fear of injuring the business interests of the state and city. Between Lyman J. Gage, who was then Secretary of the Treasury, and Governor Gage of California, there was a sharp clash of authority, the Treasury Department insisting that the full seriousness of the situation must be recognized, and the governor declaring that the state and municipal authorities were competent to deal with the situation, such as it was. The federal authorities here believe that not nearly all the cases of bubonic plague have been reported, and that many cases of death have been stated as due to other causes. It is significant that every case that has been officially reported has proved fatal, the number of deaths corresponding exactly with the number of acknowledged cases of plague. The fact that the disease has spread from Chinatown in San Francisco, which was the only locality in which the local health authorities would ever admit that the disease existed, to other towns in the western part of California, has awakened the federal authorities to the full seriousness of the situation. October 3, 1913, Berkeley Daily Gazette, Berkeley, California. The Plague Issue. For several years, there have been discussions regarding the existence of plague in the Bay section. The people of this section, generally, are on an equal, as regards intelligence, with any people on Earth, and it will be noted that these intelligent people have paid but little, if any, attention to the rumors which have been sent abroad. Eastern people, who have read the inflammatory stories, have been interested, but the intelligent people who live in this section have not been worried in the least. This is due to the fact that climatic conditions and good drainage make it impossible for a plague or other epidemic to exist in or around San Francisco Bay. Nature has blessed this section with stimulating sea breezes, which not only keep men and women up to the highest standard of physical and mental efficiency, but keep down unsanitary conditions. The people know that the plague scare has been promoted merely to make reputations for certain people. Even now in Berkeley, one of our worthy citizens, Mr. Patrick Kearney, goes out daily in search of rats, and as he goes by, our citizens smile at the ridiculousness of the proposition, although they are glad that Mr. Kearney is able to earn an honest living on the federal payroll in this manner. The mass of the people of Berkeley are simply amused at the efforts of those who would attempt to start another scare. It seems, though, that an attempt is being made, and the following editorial from the WASP is, we believe, worth careful perusal on the part of our readers. Quote, "A press dispatch from Washington states that Dr. Rupert Blue is once again more agitated greatly on the subject of bubonic plague in California. Formerly, the doctor's fears were centered on the bubonic rats of San Francisco. Now he dreads that the bubonic gophers and squirrels of the Bay Counties are spreading the germs of another awful epidemic. All this is merely preparatory to another raid on the public treasury, in which form of enterprise Dr. Blue is Napoleonic. His campaign against the San Francisco rodents was very costly. A large force of handy politicians who needed the money was kept on the salary roll for a few years. Some of them may still be drawing pay. If not, they will soon be quartered on the public treasury again, for the squirrel and gopher campaign has many ramifications and will require a strong force. The bubonic plague scare, which Dr. Blue and his political confreres made the most of, did San Francisco a great deal of harm. The term plague has a deterrent effect on travelers, and, moreover, it was threatened that our city, if not our state, would be quarantined. San Francisco had a most unpleasant experience with the Washington bureaucracy. That the bubonic scare was groundless is undeniable. The theory of the medical alarmists associated with Dr. Blue was that rats carried the germs of bubonic plague, having come here in ships from the Orient or mingled with imported rodents. All rats carry a large assortment of fleas, and the latter, as we all know, are addicted to playing pranks with the cuticle of human beings. It followed, therefore, according to the Blue logic, that the population of the Pacific coast stood in danger of a bubonic epidemic unless every bubonic rat in the sewers and backyards of San Francisco was accounted for speedily. Forthwith, the Rat Brigade, composed of politicians out of work after the fire of 1906, took the field and chased the infected game. Rats were slain by the thousands, and their death cost almost enough to build a new municipal railroad line. Remarkable to relate, not a single rat catcher was stricken with bubonic plague. It is well to bear in mind that those rat catchers were not the cleanest of people. Their occupations led them into unhealthy surroundings. They handled thousands of rats, and must have been bitten times without number by the fleas on the rats. Despite all of these favorable conditions for spreading the bubonic plague in the way that Dr. Blue and his associates declared was the way that epidemics were started, no rat catcher turned up his toes. All remained immune from plague and drew their pay with a regularity which was proof conclusive of their full physical vigor. Now Dr. Blue desires to invade the squirrel and gopher holes of Marin and Contra Costa counties and, figuratively speaking, pour the good money of the long-suffering taxpayers into them. Haven't we had just about enough of this expensive tomfoolery and graft? The patience of the public is great, but exhaustible." Unquote.